All right, welcome everyone. So we're going to begin the process of looking at our respiratory system, but in particular, we're going to focus on respiratory physiology, right? So this first set of videos that we're going to do is going to be focused on ventilation physiology, so the kind of the mechanics of breathing. So we'll talk about pressures and we'll talk about changes in volume and gradients and things like that. And then we'll have a separate set of videos that we'll look at gas exchange, right? So that kind of exchange of oxygen and carbon dioxide, right? So when we're talking about respiration, we're talking about the changes that are occurring in the respiratory system with regards to the lungs and the thoracic wall and things like that, that produce changes in volume, which cause changes in pressure, which is going to influence the movement of gases, right? So this idea of pulmonary ventilation, we're going to bring air in, right? So we're going to move air from the atmosphere into the alveoli, and then vice versa, we're going to move air from the alveoli out into the atmosphere. There's also going to be exchange of gases at the level of the lung, right? So this pulmonary gas exchange, and then exchange of gases at the level of the tissue as well, right? So terms that you may see if you watch other videos or you read in books or things like that, is two terms called internal respiration and external respiration, right? And really, these are older terms that aren't used anymore. And so, if you're looking at newer sources of material, then they probably won't use these terms. But if you do see them, external respiration was describing the exchange of gases between the lung and the blood, so at the level of the alveoli. So this pulmonary gas exchange, this would be external respiration. And then tissue gas exchange between the blood and the tissue cells or the systemic cells, that was termed internal respiration, right? But again, those are kind of older terms, and so I'll try not to use those, but if you see them, that's what they are referring to, right? So how you get the gases from the lungs to the tissue and from the tissue back to the lungs is through circulation, right? So we've had a whole discussions and lectures on circulation, right? So this is our overview of respiration that we're going to kind of get to mostly in kind of the second set of videos, again with gas exchange. This first part, again, we're going to talk primarily about the ventilation process, right? So moving air in and out of our lungs. Okay. So this idea of pulmonary ventilation, this is just breathing. Okay. So you inhale, you exhale. So a period of inspiration, a period of expiration. Often, and so right now, as you're watching this video, whether you're sitting up, whether you're lying down, whether you're walking, if you're driving, whatever you're doing, you're likely quiet breathing, right? So this term eupnea, this is quiet, normal, non-labored breathing, right? So you're just sitting, you're listening, and you're breathing, right? That's quiet breathing. Forced breathing, which you may also see termed maybe labored breathing, right? This is much more involved in the fact that you are using additional structures, primarily additional muscles, to help bring air in, but also push air out as well, right? So we'll look at this. Now, for breathing in general, this is going to be regulated by our autonomic nuclei in our brainstem, our medulla, and we'll talk about those in a later part. So you can think of it as involuntary, but we can voluntarily override it. Right. So you and think about it as being involuntary in the sense that, when you sleep, you're still breathing, right? You don't stop breathing just because you stop thinking about it, right? If we did that, we would probably all just die, right? So it's involuntary, but we can override it, right? So you can consciously choose to hold your breath, or you can consciously choose to increase your respiratory rate, things like that, right? But at a baseline, it's autonomic, right? A few additional concepts that are going to be important for this set of lectures is the idea of pressure and volume, right? So as the volume of a closed, space changes, assuming all other variables stay the same, the pressure is going to also change, right? So if you decrease the volume, you increase the pressure. If you increase the volume, you decrease the pressure, right? So there is a inverse or indirect relationship between pressure and volume. And as you change the volume, you change the pressure. Pressure gradients are going to promote the movement of air, right? So whenever we inhale, the reason air is moving into our lungs is because we have created a pressure gradient in which air is moving from outside our lung, so the atmosphere, into our lung. So we've created an area of high pressure and an area of low pressure. Right? So whenever we're doing this breathing, we're relying on several different muscles, right? So when we're just quiet breathing, it's primarily when we inhale, it's our diaphragm and these external intercostals, right? The way you can remember this, external helps with inhalation and internal helps with exhalation, right? So they're opposite. External intercostals, inhalation. Internal intercostals, exhalation, right? So breathing out. So diaphragm and external intercostals, this is what's used during quiet breathing, right? So that dome-shaped diaphragm that you can kind of see right here, and then you can see some of these external intercostals, right? The external intercostals run in the same plane as the external obliques, and the internal intercostals run in the same plane as the internal obliques, right? So just keep that in mind if you are thinking about the orientation of these, right? Now, for quiet exhalation, so whenever you exhale, it's essentially just the relaxation of the muscles and the recoil of the chest wall and the lungs, right? So basically, you contract the diaphragm, you contract the external intercostals when you inhale, and to exhale, you just relax those, right? And the thoracic cavity recoils the ribs and the sternum, and then that pushes the lung to be a smaller size, right? Now, whenever you are forcefully breathing, right? So that labored breathing, you typically rely on additional muscles for both inhalation and exhalation, right? So you can see here for inspiration, things like some of our neck muscles, so sternocleidomastoid, scalenes, and then some of our back muscles as well, right? Notice pretty much all of these are attaching to ribs in some way, right? And so they're allowing us to further move our ribs so we can bring in more air. And then when we exhale, we're using additional muscles that help to push down on the ribs, push down on the abdomen, and help force air out, right? So the big idea here is that we use more muscles when we have forced breathing or labored breathing than when we are engaged in quiet breathing, right? So when we do this breathing process, right, we have to change the volume of our thoracic cavity, right? And that's normal. So right now, take in a big breath and look down at your chest. When you inhale, you notice that your chest is moving, right? Your thoracic cavity is increasing in size, right? So the way it increases in size is it increases in size in a kind of lateral plane, and then also an anterior-posterior plane, right? Those are kind of the two main ways, right? There's also some vertical change as well. So the way you can think about this is with two kind of analogies, right? So one of these is this bucket handle example, and then one is the pump handle example, right? So let's start here with this bucket handle, right? So what you can think of here is take a 10-gallon bucket, right, or 5-gallon bucket, whatever size. The handle here is the equivalent to our ribs, and the bucket is like our thoracic cavity, right? So whenever we are at the bottom of our breathing, right, so think we've just exhaled, right? You just have exhaled. The handle is next to the thoracic cavity, and there's not a lot of space, right? As you inhale, and so you can put your hands on your ribs and inhale, and you should feel your ribs expand out, right? They're moving laterally, right? So that's like lifting the bucket handle up, and now you're creating more space between the handle and the bucket itself, right? So what that equates to is that is like increasing the rib, and you're creating more space inside the thoracic cavity, right? And then when you exhale, you drop the handle back down, you drop the ribs back down, and you decrease the amount of space, right? So this is a lateral movement. You also have an anterior-posterior movement, right? And so this is the pump handle, right? So here's a kind of an older style water spigot here. So here's the stand where the water is going to flow up, the water is going to flow out here, and then here's your pump handle, right? So normally your pump handle is kind of at this angle, and you can lift it up and water begins to flow. So in this case, the handle is like our sternum, and whenever we inhale, so put your hand on your chest, and whenever you inhale, you should feel your sternum kind of move forward and up a little bit. So just like this pump handle, it's moving forward and it's moving up, right? And so this further increases the size of the thoracic cavity. And as we'll see, as we increase the volume of a space, we're going to decrease the pressure of that same given space, right? So this is referring to, or this is the kind of summary here is that we move our bones, we move our sternum, we move our ribs in order to change the volume of the thoracic cavity, which then pulls on the lung. And by changing the volume of the lung in the thoracic cavity, we're changing the pressure inside of it, right? So what we'll talk about in the next part is some of the relationship between the pressure and volume and what those specific pressures are in our respiratory system and how we can use those to bring in air.